Hello, my name is Johnitha Q, and I will be doing my podcast on knee arthroscopy. First of all, what is arthroscopy? Arthroscopy is a minimally invasive surgical procedure used to diagnose and treat joint problems. During this procedure, a small camera called an arthroscope is inserted into the joint through a tiny incision. This allows the surgeon to view the inside of the joint on a monitor, making it easier to identify issues such as tears, inflammation, or other abnormalities. Arthroscopy can also be used to perform repairs or remove damaged tissue, often resulting in less pain and quicker recovery times compared to traditional open surgery. References for further reading include medical journals and orthopedic textbooks that detail the techniques and benefits of arthroscopic surgery. How is arthroscopy used for knee surgery? Arthroscopy is a minimally invasive surgical technique commonly employed during knee surgeries to diagnose and treat various joint issues. This procedure involves the use of a small camera called an arthroscope, which is inserted into the knee joint through tiny incisions. The camera provides real-time images of the internal structures of the knee, allowing surgeons to identify problems such as torn ligaments, cartilage damage, or signs of arthritis. Once the issue is diagnosed, specialized instruments can be introduced through additional small incisions to perform repairs or remove damaged tissue. This approach not only reduces recovery time and minimizes scarring compared to traditional open surgery, but also enhances the precision of the procedure. Studies have shown that arthroscopy can lead to improved outcomes for patients suffering from knee injuries, making it a valuable tool in orthopedic surgery. The downtime of orthopedic knee surgery. Is this procedure effective? And is this procedure cost effective? Arthroscopic knee technique is particularly effective for addressing issues such as meniscus tears, ligament injuries, and cartilage damage. Benefits of arthroscopy include reduced recovery time, less postoperative pain, and a lower risk of complications compared to traditional open surgery. Studies have shown that patients often experience significant improvements in knee function and pain relief following the procedure, making it a popular choice among orthopedic surgeons and patients alike. In terms of cost effectiveness, arthroscopic knee surgery can be seen as a favorable option when considering both the short-term and long-term outcomes. While the initial cost may be higher than conservative treatments like physical therapy or medication, the potential for quicker recovery and return to normal activities can lead to lower overall healthcare costs in the long run. Additionally, the reduced need for follow-up surgeries and the improvement in quality of life for patients further support the economic viability of this procedure. Overall, the effectiveness and cost effectiveness of arthroscopic knee surgery make it a valuable option for many individuals suffering from knee problems. How long does a knee arthroscopy take? Knee arthroscopy surgery typically lasts between 1 to 2 hours, depending on the complexity of the procedure and the specific issues being addressed. During this minimally invasive surgery, a surgeon uses a small camera and instruments inserted through tiny incisions to diagnose and treat various knee problems, such as meniscus tears or ligament injuries. Duration can vary based on factors like the patient's overall health, presence of any complications, and the surgeon's experience. It's important for patients to discuss their individual cases with their healthcare provider to get a more accurate estimate of the time required for their specific surgery. What type of anesthesia is used for knee arthroscopy? For a knee arthroscopy procedure, anesthesia is essential to ensure patient comfort and pain management. Typically, either general anesthesia or regional anesthesia, such as spinal or epidural block, is used. General anesthesia renders the patient completely unconscious, while regional anesthesia numbs the lower body, allowing the patient to remain awake but pain-free. Choice of anesthesia depends on several factors, including the patient's medical history, the complexity of the procedure, and the surgeon's preference. Proper anesthesia not only alleviates pain, but also helps in reducing anxiety, making the surgical experience smoother for the patient. References for further reading include the American Academy of Orthopedic Surgeons and the American Society of Anesthesiologists. What are potential complications of knee arthroscopy? Knee arthroscopy, while generally considered a minimally invasive procedure, can lead to several potential complications. These may include infection at the surgical site, which can occur despite sterile techniques, and blood clots, particularly in patients with pre-existing risk factors. Additionally, there is a possibility of nerve or blood vessel damage during the procedure, which could result in numbness or impaired circulation. Some patients may experience persistent pain or stiffness in the knee post-surgery, and in rare cases, there may be a need for further surgical intervention if the initial procedure doesn't yield the desired results. It's important for patients to discuss these risks with their healthcare provider to ensure they are well informed before undergoing knee arthroscopy. What can be done to reduce the risk of knee arthroscopy? Let me say that again. What can be done to reduce the risk of complications during knee arthroscopy? To minimize the risk of complications during knee arthroscopy, several strategies can be implemented. First, through preoperative assessments are essential to identify any underlying health issues that could increase risk, such as obesity or cardiovascular conditions. Ensuring that patients are well informed about the procedure and its potential risks can also help alleviate anxiety and promote better cooperation. Additionally, employing advanced surgical technologies and techniques such as arthroscopic cameras and specialized instruments can enhance precision and reduce the likelihood of complications. Postoperative care is equally important. Implementing a structured rehabilitation program can aid in recovery and prevent issues like infection or stiffness. Regular follow-ups with healthcare providers can help monitor the healing process and address any concerns promptly. References to studies and guidelines from orthopedic associations can provide further insights into best practices for reducing complications and knee arthroscopy. What is the average age group to have knee arthroscopy? Average age for individuals undergoing knee arthroscopy typically falls between 30 and 60 years old. Research indicates that younger patients often seek arthroscopy for sports related injuries, while other adults may require it for degenerative conditions like osteoarthritis. According to a study published in the Journal of Knee Surgery, the mean age of patients undergoing this procedure is around 45 years old. This highlights the importance of knee arthroscopy as a treatment option for a wide range of age groups, particularly those who are active or experiencing age-related knee problems. What is the most painful arthroscopic surgery? Knee arthroscopy is often not recommended due to several factors that can outweigh its potential benefits. One significant concern is the risk of complications such as infection, blood clots, or damage to surrounding tissues, which can arise from any surgical procedure. Additionally, studies have shown that for certain conditions, such as mild to moderate osteoarthritis, the outcomes of arthroscopy may not be significantly better than non-surgical treatments like physical therapy or medication. The American Academy of Orthopedic Surgeons has indicated that arthroscopy should be reserved for specific cases where conservative management has failed, emphasizing the importance of a thorough evaluation before proceeding with surgery. Furthermore, the recovery time and rehabilitation required post-surgery can be extensive, leading some patients to reconsider the necessity of the procedure. Overall, the decision to undergo knee arthroscopy should be made with careful consideration of the individual's specific condition and treatment options available. And this concludes my podcast for knee arthroscopy.